other way, ignore this, and so then what happens? The problem continues to grow and grow and grow. And people don't think this happens because why would the people who know how bad this is be people who also abuse substances? Well, we'll talk about that. Let me read this quote to you. Healthcare professionals are faced with a work environment in which they are expected to know more, do more in less time, lead others, and accept liability in an atmosphere that seems less respectful and often differs from their expectations during training. This situation, combined with the personality traits that are required to get through the rigorous educational and training process, can put healthcare professionals at a high risk for substance abuse and misuse. This quote comes from a psychiatric substance abuse. So, do you agree with this? Do you think that you agree with how they have stated this? About expected to know more, do more, lead others, accept liability in an atmosphere that is less respectful and differs from their expectations, their previous expectations. Yeah.
I mean, a previous expectation might be just like, oh, I'll have an office and I'll see some patients and it'll be fine and I'll get a lot of money and it'll be okay, but you might end up in like, you don't have a lot of time and it's high stress and people's lives are on the line and then you're not able to do that.
And people file complaints about you to your licensure board, we've already talked about. So you agreed with that, what do you think? Why would you agree with that?
I mean, I feel like when certain people are put under pressure, they kind of turn to substance abuse because it makes them feel better temporarily, or they forget about the stress that they're under.
Somebody else? You agree with the quote? Why? Why would you say yes? Why are you agreeing, Sophia?
For the same reason, but I also think that perhaps maybe professionals, I don't know if you really have time to get addicted to a substance if you're, in charge of your own clinic and you're seeing all these patients. I'm wondering how much downtime do you even have to do that?
Somebody else, what would you say? Yeah, Brittany?
I just feel like they feel like they have the justification to do that because they've worked so hard and they're also exposed to it very frequently, and so it's really easy for them to do it, and people don't necessarily perceive them doing something like that, and so it's easier to kind of get away with it or explain it away for themselves personally so that to them it doesn't feel like they're abusing it, but in reality, if you were to see it from an outside view, that they are.
Yes.
Also, I think it's part of escapism too, because your job is to care about other people's lives and you're emotionally invested, and then to have to go back and be care about yourself too when you've done that for 8 hours of the day. It's just I guess it would be an easier way for them to just turn off and channel everything out.
Good point. Yeah.
Along those same lines, kind of like a coping mechanism when you're put into the high stress, high burnout rate type situation on a constant basis. That's just an easy way that people know to cope. And there's other ways that they could, but that's just what they fall into.
Somebody else, what would you say? Yeah.
I think also dealing with the depressive symptoms too, their emotional is constantly being able to take it with that.
Somebody else over here, what would you agree with that quote? Yeah.
I would like to add that, maybe these professionals might have multiple families and other responsibilities, that's outside of their job.
So, meaning additional stressors on top of
Yeah.
it. Do you think this, quote is, well constructed? Do you think they got everything in there very well, succinctly? Yeah, Omer? Repeat it, okay, yeah.
It was
So
long.
just listen to it, because I think they touch on everything very well, without saying, in pages, they get it very succinctly. Healthcare professionals are faced with a work environment in which they are expected to know more, do more in less time, lead others, and accept liability in an atmosphere that seems less respectful and often differs from their expectations during training. Meaning while they're still in educational phase training, before they're actually up there, fully licensed and working. The situation, combined with the personality traits that are required to get through the rigorous educational and training process, can put healthcare professionals at a high risk for substance abuse. What do you think those personality traits that are required to get through healthcare training? What do you think they are? Jonathan? Diligence, yes, Amir? Mental endurance, yes.
I was about to say that.
Perfectionism, okay.
That's what I was going to say, perfectionism.
Somebody else? Resilience, commitment. Everybody's got to have endurance to keep going for a long time, right? Does that mean everybody in this room possesses these personality traits, right? Well, yeah, it's true. It's true. If you don't have that resilience and commitment and endurance to keep going for years, you're not going to make it. Yeah.
I was going to kind of, not necessarily a trait, but just like isolation, because in order to get through it, you can't really have like outside relationships, and so it's easy to do that once you start abusing whatever it is that you're doing. It's, if you're already isolated, it's easy for you again to justify it.
Yeah. Because then sort of isolation, meaning like, all along the way, you have to say, people approach you and say, oh, let's go here, oh, do this, let's go do that, let's go. Can't you go away for the weekend? Can't you just have to always have to say, no, I have this. No, I have to do that. No, I have to do this. No, thanks, I have to do that. I can't. Right? So, so it's kind of an interesting combination there. How they're coupling the workplace issues in relation to the personality traits. So some of the things that people brought up in relation to why do healthcare professionals maybe turn to substances. And as Brittany brought up, well, I'm a driver during the day, but then when I go home and I feel this way, I don't turn to others, I turn to substances, because it's kind of like a self-medicating thing, and I'll manage this on my own as opposed to seeking help. But as we know, substance abuse isn't a way of managing that, it's just a way of creating other additional problems for the person, right? Yes? We're going to get good question. Okay, so I want to introduce it that way because that's a quote that comes directly from a psychiatric facility that treats impaired healthcare professionals. And that is their very succinct way of saying, this is our patient population. This is who we treat. Okay, so remember how we have talked about our licensure boards in that we talked about all of those different disciplinary actions, right? So, what happens also with our licensure boards and disciplinary actions is that every licensure board also has a disciplinary action to address this. So in other words, if patients go to healthcare professionals, and a very common one is, and very easily detectable, people go to a dentist. And they can determine, oh, wow, because the dentist is right there, and they're breathing on me as a patient with alcohol breath. I can tell they've been drinking. Whoa, I really want this person to drill on my teeth. So that's a very easy area of detection for patients. Patients complain also if they go to any kind of healthcare professional that descriptions like unstable, seeing them kind of weaving down the hall, walking like that, incoherent speech, talking to the patient, in other words, doesn't really make sense, that odor of alcohol, ingesting alcohol, not being able to focus on what the patient is saying, kind of asking the patient, could you repeat that over and over again, because they're not able to focus on what the patient is saying because they're inebriated or combination of drugs and alcohol. Keep dropping things, dropping instruments. Yeah, that'd be really nice. Someone coming towards you to give you an injection and they keep dropping it on the floor. Bad. So very obvious, patients can pick up when someone is impaired like that. And so that is an area of complaints, patient complaints to licensure boards. And so, all boards address this in different ways, but so we'll talk about the predominant boards, in other words, where they have institutionalized this disciplinary action. And so that's the medical board for NB and EO. So if a doctor receives complaints from patients or coworkers in relation to substance abuse issues, as you know, the board, the staff has to investigate all complaints. So this is the same, they investigate complaints like that from patients or concerned colleagues that Dr. Brown's dental partners are concerned that he comes to work frequently inebriated, patients complain to staff, etc. So they can receive complaints in this area specifically. Because why would colleagues call licensure board and report coworkers about this kind of stuff? Why do you think this would happen more frequently than others? The mayor? Correct, yes. What else?
Since the person's like all drugged up, this person won't be able to do all the responsibilities, therefore giving more weight for others.
Correct. That's another one, yes.
If they're found to know about that and not report it, then it becomes complying with their bad action.
Correct. Enabling that behavior you knew and you didn't do anything about it. Yes, Antonio? Yes. You gonna say something, Tim? So, okay. As well as they're concerned that patients might view this as, well, if my dentist does this, probably other ones in the practice do this too. People are very concerned about other, obviously as healthcare professionals, you don't want that type of image or behavior attached to you and your performance. And so this is probably the biggest area where we talked about the peer review action kind of thing. This is probably the biggest area where coworkers, colleagues will contact the board and file complaints. As well as, it's not only peers, there might be other coworkers. In other words, nurses in the same office, depending upon where the healthcare professional works, that type of thing. So meaning other healthcare professionals of holding other licenses. So, also, they're concerned about the welfare of the patients. I saw the doctor do this. I saw the doctor give the patient the wrong injection. I saw the doctor do, things like that. So concern for the patient's welfare. So when this type of complaint is investigated, what happens is the board contacts the doctor and conveys that these types of complaints have been filed. And let me read one to you here that's, wow. This is, of course, from the board, the medical board, for they suspended a physician that was doing his residency in Carrollton. Who knows where Carrollton is? This is right around here. So, meaning that this physician was not completely licensed. So person's still in residency. So the board suspended without notice, meaning they investigated these complaints and they were serious, so immediately contacted the physician in training and suspended his license. In other words, stop right now, you can't do anything else. After determining the continuation in practice of medicine possesses a continuing threat to public welfare, the board found Dr. Waters is unable to safely practice medicine due to substance abuse. While deployed with the Army National Guard, Dr. Waters was apparently called to serve in a medical unit in the capacity as a physician to treat civilian patients. During the service, Dr. Waters was working the night shift as the doctor on duty. Several medics were also on duty at the same time in the same location. During the night, the medics witnessed Dr. Waters acting strangely. Dr. Waters emerged from the temporary sleeping area and asked the medics on duty why they were still awake and told them to go to sleep immediately. So obviously observed this strange behavior, saying strange things. Several hours later, Dr. Waters again emerged from the sleeping room. He stumbled down the hallway, leaning heavily against the wall for support, and was mumbling incoherently. The medics assisted Dr. Waters to a cot and began providing medical assistance. Dr. Waters was observed to have IV site marks on all 4 extremities, including in between his toes. Serious abuse. One medic went into the sleeping room and observed dozens of used syringes, bloody gauze, and empty IV bags of fluid strewn around the room. In addition, there were empty vials and bottles of medications. Really brilliant move. This person at this point in time will never become licensed. Did this during residency. Really bad. Okay, so when any type of complaints in relation to observing substance abuse behaviors, the medical board has a specific program, and it's called they give it a very innocuous sounding name, physician health program. It sounds like, going to the gym and exercising, proper nutrition. And it isn't. But the name is purposely, I think, innocuous to kind of cover. But every state medical board has the same thing, you just slot in the name of the state in front of it. So here in Texas, they abbreviate it many times in writing. You just see TPHP, Texas Physician Health Program. And people don't know what that is, they don't know what it is. And they do it that way on purpose. Yes.
Because it's just for medical doctors?
Yes. And so they don't advertise, obviously, what this is directed towards, because they don't want to freak out the general public that they have to have a program for this. Meaning, we're talking about a lot of people, not only two. So the Texas Physician Health Program is specifically functions in this way. If a physician is found after investigating these complaints and grievances to have a substance abuse issue, the board will contact that person and say, these are all the grievances, we have, we've covered this part, we've investigated this, we have found blah, blah, blah. So then they tell the physician that you must participate in the physician health program. And most physicians don't know what this is, so they explain it to them. What it is that the licensure board has a listing of all specific substance abuse programs of mental health facilities that have this specific substance abuse program. In other words, the board contacts mental health facilities that have substance abuse programs and asks them, would you be willing to carry out, have our specific parameters for a substance abuse program for doctors. And so some facilities are willing to offer this, other facilities don't. That's why this is not available at every substance abuse facility or program out there. So the facilities that are willing to offer this, and I'll talk about how that's designed, why it's specific and different. So facilities that are willing to offer this on an ongoing basis all the time are then put on the licensure board list for this. So it goes on the Texas Physician Health Program list. So that when doctors are found to have a substance abuse problem, they are given this list for their state and told, pick one of these specific programs that are designed for healthcare professionals, go there and admit yourself. In other words, present yourself there for assessment and admission. They give them 1 week to do that. In other words, this is very serious. So once they select that program, they have to report to the board which program they will be participating in, where it is, which one they're going to. Because, and again, they give them a week from when they stay on this, because obviously from what example I just read, it's very serious. So they contact that program because it offers a specific substance use program for doctors and say, we have just referred Dr. Brown and he has selected your program to attend. Please contact us and let us know when he presents himself there for admission. So you can see that this is different because, number one, normally all mental health programs are confidential. This is not. In other words, because of this particular situation, that's why the mental health facility has to agree to offer the specific program. In other words, follow the procedures of this program that has been developed by the board. So this is different for doctors than it is for other patients. So the facility reports to the board if, in the next 5 days, if Dr. Brown has appeared or not and has been assessed and admitted. Because these programs are inpatient. They stay there. It's not outpatient where they go home. So it's intense. Yes?
Is the doctor paying for the program?
Yes. So it's serious. Okay, so both of these first scenario, the doctor shows up, is assessed and admitted to the program. So the facility calls and says, Dr. Brown has appeared, he's been assessed, he's been admitted to the program. Okay, so these programs, why they're separate and different is that from other programs where there are other people in them, is that these programs address these specific things that were just outlined in that quote. In other words, the only people in this specific program are doctors, dentists, other healthcare professionals. And so they are kept separate. So why do you think they are in a separate program from other patients in the same facility? Why do you think that would be a stipulation of the design of the program?
Protect their reputation from getting out to there and the
Yes.
things that they.
It wouldn't be too cool to be, these programs are usually a combination of individual and group. Wouldn't be too cool to be in a program where, hey, there's one of their patients, here's another patient, out there in the community. Not good. That's why they're specifically designed in facilities. That's why every facility doesn't agree to do this. So they are in the program with other impaired healthcare professionals. Okay, so from the beginning, their participation is monitored by the board. In other words, did they show up in that period of time? Are they admitted? Also, it's different because the therapists who work in this program have to submit progress reports on the doctor. Every few days, are they participating? Are they making progress? All the different types of things substance use program. Did they try to sneak substances? Did people visit them and try to give them stuff? All of those things that are monitored in those kinds of residential programs. Also, these types of programs are always in very rural areas. They're always out in the middle of nowhere. Why do you think they're in locations like that? Why does the board also approach programs that are located in places like that? Yes, Mayor.
The city life is definitely more stressful.
Yes.
One destination particularly relaxing.
The greenery is relaxing, yes, but what else? Yeah, so that they're purposely removing them from very busy populated areas where we don't want people, former patients, current patients of the healthcare professionals to see them walking in and out of the facility. So that's why, the other reason why the board doesn't approach every mental health facility that has a substance abuse program. A lot of them are right in the medical area where the healthcare professionals work. They don't want their colleagues or patients to see them walking in and out of the facility. So they also only select places that are in the middle of nowhere. So there is one in this area that participates in this that is like 2 hours north of here in the middle of nowhere. That usually gets people from this area. So the therapists who work in this program with the healthcare professionals have to submit progress reports either way. Are they participating? Are they progressing? Are they getting better? Or not? And at the end of the program, and these programs are usually like a month long, the therapists have to submit their final report, the discharge report, in relation to, do they think this person is able to return to performing the type of work that they were doing, or not. Their ability to return to work. Okay, so if the person progresses, does well, they completed the entire program, they didn't go for a week, drop out, that type of thing, they have progressed, they realize the errors of their ways. In other words, you are endangering the patients. Not only are you doing this to yourself, but you're also endangering every patient you work with. All that kind of, so they do well, they can return to work. Okay. If they don't complete the program or they don't make progress, they see nothing wrong with what they're doing, they feel like they can control their substance abuse to where people won't know what they're doing. Well, you've got all these complaints, how can people know what you're doing? So in other words, they didn't make progress, they didn't improve. Then what happens is, so we have two kind of paths here. People progress, they do well, then you've completed the program. As far as the board is concerned, you've completed the program, well, closure on that. So people who drop out don't do well, don't understand the errors of their behavior, don't see why they have to change. Why is this a problem? I'm shooting up every day. All extremities, why is that a problem to others? You know, what's the big deal here? So if people don't do well, then what happens is this program continues. In other words, there is ongoing monitoring of that healthcare professional in their workplace. And how that happens is therapists from their program will do pop-in visits. They just show up in their workplace and ask to see the person in their office, and basically it's like pop assessment. See how they're doing at that time, what their behavior is like. And so that goes on for a period of time as far as the surprise assessments. They also conduct random urine testing in the workplace. As well as that ongoing workplace surveillance. In other words, therapists might pop in, but they don't pull the person aside to assess them. They might kind of wander around all day and observe the professional behavior. In other words, are they staggering down the hall? Is there, when they talk to people, is it coherent? Are they able to focus on things that they do? Are they able to type in the computer or not? When they observe their behavior in the workplace and see if there's impairment. Yes.
Do they go inside when they're treating the patient?
No. They have to leave that up to the patient to file like they want to. But how they're interacting with others, are they able to function on their job? Or, because people, substance abusers can basically get themselves to work, but just being present does not mean that they can function in the workplace. Coworkers will complain about, read their documentation, makes no sense at all. So they can appear as if they are doing things, but be severely impaired. Trip, fall down. So it becomes obvious to people who see them every day in the workplace. So if that ongoing monitoring proves to be bad, the outcomes with that are bad, then what happens is that same doctor is approached again and they're told, go back to the same program, pick another program, we don't care, but you have to participate in the program again, you must complete it. In other words, that's strike two against it. So what happens is, remember how we talked about with all the other disciplinary actions, they're made public. Okay? This, because of the severity and what's involved with it, the first time the person participates or is referred to the Texas Physician Health Program, it is not published anywhere. The second time, in other words, if they don't attend, they don't take it seriously, they're told to participate in it again, then that disciplinary action is published. It becomes public. So, very serious stuff.
After they fail the second time, or like immediately, like
When they're referred the second time, it's published as a disciplinary action. The board states Dr. Brown must participate in the Texas Physician Health Program. Everything before that is not published, yes.
So is the random monitoring only for physicians who didn't, I guess, complete the
Yes.
program?
Yes.
Okay. So like the person who completed it, they don't have like random like
Right,
check.
right. Because it all goes by all of those progress reports of the therapist during that program.
How does the board allow somebody who didn't complete the program, who basically admits to like they're not doing anything wrong, go back to working?
That's the first, I guess they're giving it as a first, this is your chance, first chance. So that's why they have that as, the strike two, then it becomes public.
But I feel like the board is meant to protect the public from us,
Right.
but if these physicians are impaired, I mean, that kind of like,
Because, there's a great range of impairment.
no, I understand, but it's
Yeah,
just,
and that's what they're going by.
it's just like really messed up.
Yeah, I mean, this is serious stuff. Okay, so impairment is considered to be, impairment of healthcare professional was considered to be the inability or impending inability. Meaning, they're kind of trying to cover the range there. Total inability, like, can't balance, can't function, can't write, can't function. Inability, or impending inability. In other words, they're getting worse. The substance abuse is getting worse or continuing. So, or impending inability to practice according to accepted standards as a result of substance abuse or addiction. So, in mental health, we make a distinction between substance use, abuse, and addiction. So they're kind of on a range there, meaning people can use substances. There's people out there who use substances sporadically. That's just use. It's still wrong, but that's use. Substance abuse means it becomes a more repeated behavior. And then addiction is the other end of the spectrum where they're doing this constantly. And as you know, any addiction is the person's behavior, thoughts are consumed with, where am I going to get this stuff? How do I get the money to get this stuff? How do I procure this stuff? Taking this stuff, looking forward to taking this stuff again. So it's that constant behavior, which is addiction. Okay, let's see. So another quote from a specific program that treats impaired healthcare professionals. When a professional is referred or seeks treatment for a substance abuse or addiction, the professional is often feeling anger. This is after they've been referred by their board. Is often feeling anger, shame, or fear of losing everything that is important to him or her. At the same time, he feels the loss of what started as an oasis from a complicated and stressful life. Those are some of the examples people brought up before. When I asked, why do you think healthcare professionals might turn to abuse? Where they're home alone, in isolation, they turn to substances to alleviate stress. And as Jonathan brought up, many times healthcare professionals will cite a combination of work-related stress and family-related stress all together at the same time. So these programs address all of that kind of stuff. Okay, here is a board example of what I was just talking about in relation to the second disciplinary action, strike 2. A physician was referred to the Texas Physician Health Program. The board found Dr. Daniels is unable to practice medicine with skill and safety due to chemical impairment, and he is unwilling to cooperate with the board referral to the Texas Physician Health Program. In other words, he's referred to substance abuse, says, no, I'm not going. Dr. Daniels underwent an evaluation at an addiction recovery center. A report of the findings and recommendations from the healthcare professionals indicated that Dr. Daniels has a physiologic dependence on opiates with increasing use over time and an inability to stop. The report recommended that Dr. Daniels sign, whoa, this is a serious person. The report recommended that Dr. Daniels sign a 5-year monitoring contract with the Texas Physician Health Program and complete a long-term residential treatment program for chemically dependent physicians. Dr. Daniels denied he was an addict and had indicated he had no intention of entering a long-term treatment program. Goes on to say later on his license was revoked. So the article I will give you for this topic, it's interesting in that